Hi, I'm Dr. Ivan. It's late Saturday night, but I promised Grayson, my Instagram marketing guru, that I would get this video out. This topic is going to be a little bit longer than normal. I usually try to keep these videos short and sweet, but this topic of bruxism, or tooth grinding, what I call occlusal disease, is too important and has too many far-reaching effects, cosmetic and functional, that it deserves a little bit more time. So forgive me, this is going to be a little bit longer, and also forgive me because I have to read because there's so much to talk about. I can't remember all of it by memory. I'm not a good actor that way, so I'm going to be reading my script, but I'll try to not make it sound boring and monotonous. So anyway, bruxism is one of the most prevalent dental problems there are, even more than periodontal disease and cavities, which is what your typical dentist always looks for when you open your mouth in his office. And it remains one of the most undiagnosed dental problems, which is such a shame. The damage can be incredible for a severe grinder, to where we have done full mouth rehabilitation. That means fixing every single tooth in the mouth, rebuilding all the teeth in the mouth to a more normal, functional, and cosmetic size. And I've done it on someone as young as 25 years old. The treatment to rehabilitate costs tens of thousands of dollars, so awareness and prevention is absolutely the key. It's shocking, but even more shocking is how many patients don't even know they grind their teeth. I can't tell you how many new patients come into our office for whatever services, and I can tell, and if the subject gets around to it and I can offer my opinion, I'll tell them you grind your teeth, and so many people never knew. That means that their dentists have never diagnosed them as with occlusal disease or grinding their teeth. And if you don't know that you grind your teeth, there's nothing you can do to prevent it then. And that's a shame, because then you'll continue to do damage. I've had people that have done so much damage they've grinded off as much as 35 to 40% of their teeth by the time they're 30. That's a severe grinder, and that's a darn shame. Too many dentists think that maybe this is normal, or we're never trained to observe it, acknowledge it, and treat it. So that the fact remains, a large proportion of patients routinely grind their teeth, and that's why nearly 3/4 of all my patients wear protective oral appliances to protect their teeth and their dental treatment, especially if they're a cosmetic patient and have these beautiful veneers in their mouth. I don't care how beautiful they are, you'll ruin them if you're a bruxer. So we need to understand how you function so that you don't damage all of our beautiful teeth. And after I do a bite change and veneers, I often put my patients in some kind of protective oral appliance to protect their investment. And many patients already understand that dentistry is all about prevention, and the severe damage that occurs from bruxism is largely preventable. One of the myths that many patients and doctors still believe is that people who grind their teeth only grind their teeth at night. This is a myth. Bruxism occurs as part of sleep. It's often associated with sleep apnea, but we grind during the day also. And the other myth is that when you're awake, people think that you can't possibly grind, or you'll be aware of your grinding. And that's a myth as well, because you can be completely unaware that you're grinding your teeth while you're awake, as you sit in front of your TV or exercise or at work. It's so a part of your normal functionality that you're unaware you're doing it. So the good news is that when you are made aware of it, there is something you can do to prevent occlusal disease. Why would a cosmetic dentist like myself know about bruxism? If you recall from prior videos, I told you some of the most knowledgeable and highly trained dentists are cosmetic dentists. As a result of our training, we came to understand it's not possible to give patients wonderful, beautiful smiles without understanding the neuromuscular and orthognathic function very well. In other words, what good is it to put nice-looking veneers on patients who would destroy this beautiful dental work in a short amount of time because they're severe grinders? We need to preserve this beautiful work, and so we must understand how you function, how your jaws, your teeth, your muscles, your bite, your head and neck all function together in harmony. On a side note, This is also why I am board eligible and qualified sleep dentist. The head is indeed connected to the rest of the body, and how you are put together can cause upper airway obstruction leading to hypoxia and hypoxemia and obstructive sleep apnea. It's a chronic disease with potential deleterious health sequelae and fatal consequences. But let's not digress into that. The other cosmetic issues that also develop out of bruxism is that your teeth and jaws support your lip and your face. Lips and face. If you didn't know this, just take your teeth out of your mouth and look at what happens to your face. Ha ha ha, but true. This is exactly what happens when a denture patient takes their teeth out of their mouth, their face collapses. So in cosmetic dentistry, we measure the proportionality because so much of what we think is beautiful, like a beautiful model on TV or in magazines, our beautiful actresses, have natural proportionality. What that means is that while there are beautiful exceptions, the face can be divided into horizontal thirds. And when the lower third of the face is very short, it has what we call the Robin Williams effect. The late comedian made a great Popeye because of this result. His nose and chin was very close together. Normally, this is not a good look, especially for women. What we call the nose to chin ratio. When it is foreshortened, it not only ages you prematurely, but can lead to more perioral folds and wrinkles and even jowls. And at a certain age, this is not desirable to many women who come to our office. Now you know why we created the unique Radiante Dental and Facial Spa. The face and your dental work and your jaws all come together to form what we consider proportionality and beauty. Finally, many bruxism patients also suffer from what we call neuromuscular issues such as TMJ or TMD that turn into daily or weekly severe headaches that can lead to monthly debilitating migraines, neck and shoulder and arm neural problems, all generating from abnormal forces of a bruxer. So there's way more to this but I think you get it. Bruxism is a serious functional, cosmetic, and financial problem that is too often undiagnosed but can be easily treated and largely prevented with early detection and a conservative treatment. Please ask your dentist about bruxism and if you have occlusal disease. And don't take, you grind your teeth a little. Don't take that for an answer. Absolutely get protection, get an oral appliance. They're very inexperienced insurance to wear during your sleep, and you can even wear it during the daytime. I wear mine during the daytime when I know that I'm grinding during the day. So use that as a good education and talk to your dentist, and I hope that was informative information for you. Talk to you later. I'm Dr. Ivan.